So today we are going to talk about a case, and one of the things that I've been thinking about, wasn't really sure if it would go over, but is to talk about education from a case-based learning. And so that's where we actually talk about, these are going to be fictitious, there we go, fictitious cases where I've changed the names of people to protect them, but they're cases that I see. And so I'm going to present them to you just like they're presented to me, kind of walk you through how I do everything in my job, and then hopefully the clients can learn why a veterinarian is needed. The veterinary technicians can learn what their part is in this entire procedure, and then maybe even some veterinarians want just a quick review for their own practices. And so this week the case is going to be about Oliver. Oliver's parents called the clinic, and they were concerned about Oliver because he had been dragging his rear end across the carpet, scooting. We're going to call this the boot, scoot, and boogie case, for about a week. And so we were able to get them in. We brought him in for an appointment, so we made that appointment. The owners expressed to us that they were concerned that Oliver had a parasite, and that's a pretty common concern for owners. They're gross, nobody wants them in their homes. And so they were truly concerned that this was a parasite going on. And so we want to evaluate that as well. So Oliver is a 5-year-old terrier mix, and you can see in the picture that Oliver is a male. He's neutered. He lives inside primarily. He is neutered, if I didn't say that. And he is currently about 16 pounds, and you can tell from the picture that if you're a nurse that Oliver's a little overweight. Nonetheless, that's a separate subject. And so Oliver eats Beneful. He eats about a cup of food a day, and Oliver is not on flea and tick. He is not on heartworm medication. Oliver's going to predominantly live inside, but he does go outside, obviously, to urinate, defecate, and he does go on walks with his owners. Not very often. They're very busy, and so they're not able to do that as frequently as they would like to do it. That's pretty much, I think, the gist of Oliver. I think we said he's not on heart and flea and tick. He hasn't ate anything lately that would be abnormal. So Oliver hasn't gotten into the trash. He hasn't ate any toys. They did notice, though, that Oliver, about 2 weeks ago, had a bout with diarrhea, but it resolved on its own within 48 to 72 hours. They weren't exactly sure how long it lasted, but he did have that going on, and it did go away over time. So again, we do our normal gig, right? So we bring Oliver into the room, we talk to his owners, we kind of get a history of what's been going on with Oliver. Then we take a look at Oliver from a physical examination standpoint. And so we're going to look at Oliver from his head to his tail. We're going to look from the top to the bottom. And we're going to see what can we visually see with Oliver. And the biggest thing we saw with Oliver in this case is that Oliver was pretty obese. So as you can tell from the picture, he had been eating more than he probably should have been. So he was about a body condition score of 4 out of 5. His rectal exam was one of the things that we really noticed about Oliver. His anus was swollen, so the area around his anus was swollen. And when we did what's called an anal gland expression or rectal So we go in and we do a rectal exam, and then we feel for these anal glands. They were swollen, they were full, they were thick and painful. Anal sacs. So a lot of times they're called anal glands, but that's really a misnomer. The proper language that we should use is an anal sac. We noticed that there was definitely some changes there that weren't there. So based on the findings, based on the fact we had this thick, smelly, odorous, definitely scooting, the history, the being overweight, all kind of linked into that Oliver had anal sacculitis. And anal sacculitis is, if we break that down, it's anal sac, which is this anatomical structure they have, that causes inflammation. And itis, anytime you add itis to the end of a word, you're talking about inflammation. So we had inflammation of the anal sacs, which is a disease. It's actually not supposed to be there. You're not supposed to have to express these anal glands all the time. What are anal sacs? So anal sacs are these little pockets that are on either side of the anus that you can see. Let me annotate here. So you can actually see them right here and right here. And we go in during the expression. So during that physical exam, we go in and we push that material that accumulates inside that anal gland out by pressure with external force and internal force. And there's these little holes in the anal gland that material should express from naturally. And so it should come out of there all on its own. We shouldn't have to express them. They should be normally doing that all on their own. And when they defecate, we should never really have to express anal glands. It's not something that we should have to do. And so again, just showing you another picture of the anal glands themselves, kind of where they're located. And then in this image, you can see kind of, here's the colon. Here's the internal sphincter, external sphincter, which is your rectum, and how these anal glands empty out into here. And so we put force here on the outside and then digitally on the inside. And for technicians, it helps to get behind this anal gland if you can and push from here forward. I think that's your best when you're first learning how to do it. That's probably the best advice I can give you. So they should normally express these anal glands all on their own. They should be doing that during defecation. They should not have issues expressing them, and it shouldn't be painful, and it shouldn't be thick and odorous like we had in Oliver's case. So the anal glands are a reservoir, basically a pocket of apocrine and sebaceous gland secretions that should be expressed. We don't really know why they're there. We think maybe there's some historical significance going on, and that's what we think the purpose of them is, but they normally are smelly. People talk about them getting excited or fearful and expressing their anal glands, and you can smell it in the environment. It's a very distinct smell. The secretions, the inside stuff, usually is thin, clear, yellow, gray, or brown. And it can be granular and all of that be normal. It's when they get thick and painful that we have concerns. So what are some other signs that clients tend to notice when other than just boot scooting boogieing across the floor or dragging their rectum across the floor? Well, they might be licking or biting at their tailhead, or even their rectum. One of the things we have to think about there is this a flea issue? Is there a skin issue, a dermatitis issue on top of that? So just because they're doing that and just because they're scooting on the floor doesn't mean that it's an anal gland issue. You really do have to put all the pieces together and have some experience knowing what you're looking for. They might tail chase. again, that smelly discharge, pain in the rear end, behavioral changes, straining to defecate, ribbon-like stools, constipation, blood in the stool, so hematochezia, and then reluctance to sit. And again, all of those things have other reasons, which is why I can't just say to you, hey, if they're doing this, it's this. No, we really do need that physical exam because we need to look for arthritis. We need to look for fleas. We need to look for hip dysplasia. We need to look for underlying GI issues. And so what are some of the things that we think about when we have a patient present like Oliver did? Well, it could have been fleas. Oliver wasn't on flea and tick medication. It could have been cancer. So anal glands, anal sacs themselves can get tumors inside of them or form cancer. And so that's something that is super important to have checked out. They can fistulate. The anal gland can form this little tube-like structure off in its own little area. They can cause tail fold dermatitis, can cause these symptoms. Just skin issues. I see tons and tons of dogs a week that have allergies, either food or environmental, and that can actually set off or be an underlying cause for anal gland issues. So it could be that in and of itself, or it could be something else. So skin issues, vaginitis, inflammation of the vagina can cause this. So that's something we have to consider. Not necessarily in Oliver's case. He's male and neutered. The anal glands can be impacted to where they can't express. Again, that's not normal. So it's a disease process. They can abscess or rupture. I call it an anal gland blowout, where the anal gland ruptures out to the outer surface around the rectum, and you've got blood and discharge, and it's just really gross and it's extremely painful. Some of those cases have to be anesthetized or even sedated in order to work on them. It can be behavioral issue. It can be nutritional issue. Like in Oliver's case, his problem primarily that's probably causing an issue is the fact that he's overweight. And we'll get into that in just a second. GI problems can cause anal glands. Itchy, pruritic skin can just cause dragging your rear on the floor. And then it can be idiopathic, meaning idiopathic means there's no reason for it, but idiopathic is something we have to rule out all these other causes for. We need to look at all these other problems before we can call it idiopathic. So in Oliver's case, or in any case of anal sac inflammation, it's not normal. It's not something that you should have to do. And I think that's a misnomer for a lot of clients. There is an underlying problem, whether it's caused from some of these other things or it's idiopathic, meaning we don't know what's causing it. It's not normal. One of the biggest reasons I see for an anal gland coming into my office is that the pet has decreased muscle tone because it's most likely obese. And so just addressing the nutrition and addressing that can be huge. Oftentimes these pets, when they come in the office, just like Oliver did, had a bout with diarrhea or constipation recently. And that could be what set off this particular single incident. Now, in Oliver's case, it could have been, or it could be the fact that he's obese. And that's where the doctors sometimes need to step back, find out everything, and then they attack it in multiple different ways based on what they're seeing. And that's the art of medicine and the practice of medicine. It's not a concrete answer all the time. Sometimes we're very good at our jobs and this is the problem. Other times there's multiple things at play. And so until we start kind of resolving those, what if Oliver had fleas today too? Was it a derm issue? Does Oliver have an allergy? Maybe he's got obesity and then he had this diarrhea episode. All those things have to be sorted out, and sometimes they take time and rechecks. So I don't want people to get frustrated. lot of times, simple cases like this, where we get an answer very quickly in the room, aren't necessarily straightforward for treatment, and that takes time. So we will usually get to an answer. We'll usually get to a better place. It just takes a little bit of time to get there. And I think that's very frustrating because we live in a world of immediate answers. So sometimes if it's a diarrhea or constipation issue, it may be related back to the obesity. It's oftentimes one of the things that we'll do to try and help with anal gland issues is put them on a higher fiber diet. It's one of the only thing that's kind of scientifically proven to help with anal glands, other than treating the underlying problem. And so WD is a food that we'll often use. It's by Hills. There's other prescription diets, pumpkin, bran, psyllium, all those things are things that we might try for you, or a veterinarian might try for their patient. Bacterial contamination. Sometimes it's a one and out, it's just that they got infected. Sometimes it's a nasty bug, and actually in rare cases, but in complicated cases, we need to actually culture and do a sensitivity of that bacteria to find out which antibiotic is best. Dermatitis, allergies, food allergies, like I said, those can all be issues that can cause anal gland problems. And so until we address the underlying issue, until we address those problems, the anal glands are going to be a constant issue. So rarely these things are needed. And most of the time on your first anal gland case, we're going to go through and we're going to try to address all these underlying problems before we get into major databases. But these are all things that a doctor might ask of you for something that seems very simple. We might want to look at a CBC, which is, what are the red blood cells? What are the platelets? What are the white blood cells doing? We might want to look at the chemistry. What is our calcium doing? What is our liver doing? What are our kidneys doing? Urinalysis is like this forgotten database of information that we can get from it. So they might want to do that. Again, we talked about that anal gland issues can be cancer. So they might want to look at calcium levels. They might want to do an impression, a cytological exam, where we press and get cells from that discharge and see what's in there. Is it bacteria? Is it yeast? What is going on in this? Then again, I said already, we might want to culture it. If we're suspecting cancer, we might want x-rays to look in the chest or in the abdomen for other types of cancer. If it's a really suspicious cancer case, we might want histopath, which is where we send it off to have it evaluated, a piece of tissue. Sometimes parathyroid hormone is recommended because sometimes parathyroid hormone gets all sorts of out of whack when there is a cancer. So I don't want you to think it's super straightforward and that we have all of these great answers at bay. There's tons of stuff that can be involved with anal glands, and really, I think a lot of times it gets thought of as normal, and it is not normal. We need to address what the underlying problem is. And even if that answer comes back idiopathic, at least when you ran the test, at least when you did the information to get that answer, it's at this time, it does not appear to be cancer. That at this time, we don't see any kidney issues, liver issues, and that has to give people some peace of mind. And I think people get really frustrated. Well, we don't have an answer when we run these tests. Yeah, we do. We have answers that it's not this. And that is just as important.